That most people's hip pain doesn't come from the hip, it's a spiral in the leg. So there are cases when people fall down roller skating and they cause trauma in the hip. That is true, but it's rare. And most people's problem, it comes from a spiral in the leg. So for example, early on they have a couple ankle sprains or a broken foot or plantar fasciitis, and it causes the lower leg to tighten and harden. The fascia in the lower leg will stiffen and harden, and the lower leg starts to rotate outward. And once it crosses the knee joint, it compensates, it starts to pull inward. So this is a spiral. And then once it crosses the groin and the hip, it starts to correct outward again. So you start having pain here in your hip, and it's not coming from the hip, it's coming from the spiral in your leg because you've got an old trauma in your leg creating this spiral. Most people are given a diagnosis of arthritis or degenerative disease, or you're just old. It's not true at all. In most cases, people have an old injury to their leg that causes a spiral that ends up in their hip. The way to correct it is fascia body work, massage therapy, yoga, and functional movement. You can't just put muscle on top of it. You've got to unwind the leg to get to the hip issue. You can't just treat the hip, you got to treat the whole leg and unwind the leg. If you'd like to learn more, I've got an exciting video on YouTube. It's called New Anatomy versus Old Anatomy, where I share with you the truth of the body. If you want to heal your hip, you got to heal the whole leg. Join me there, be part of the leading edge revolution of people looking for new and exciting ideas.